Thank you for joining the AAN Virtual Resident Education Lecture Series. Today's topic is Intro to Integrative Neurology with a focus on mind-body medicine. Today, we also have Dr. Daniel Weber joining us as our Q&A moderator today. I am pleased to introduce our speaker for today, Dr. Sarah Mulakutla. Dr. Mulakutla is a neurologist who has taught meditation and mindfulness since 2012. After completing her neurology residency at Yale University, she has incorporated the principles of yoga and meditation into her research to treat neurological conditions. She is the founder chair of the American Academy of Neurology section on neurohealth and integrative neurology. Dr. Mulakutla completed her medical school training at Stony Brook University School of Medicine. She received her undergraduate degree from Harvard University and is currently practices at her private clinic, Mindful Neurology, PLLC. Dr. Mulakutla, we are so excited to have you here today. Please, I pass this over to you.
Thanks a lot for inviting me to be here today, and I'm excited to talk about this topic. This is near and dear to my heart, and I welcome thoughts and questions on your end. As I was explaining before, I'm used to giving interactive lectures, and I will proceed in that way. So if you have any comments or questions, please do feel free to use them and they will be addressed. So let's go ahead and get started. Okay. This is our presentation for today. I have no disclosures to report. This is my plan for the hour today. I would like all of you who are here and watching on and offline to understand what we mean by integrative neurology, and in particularly the importance of the evidence-based component of integrative neurology. We're going to review resources that can help you further your knowledge. We're going to talk about the AAN initiatives related to integrative neurology, brain health, neurohealth. And then we're going to switch a little bit, if there's time, to some mind-body medicine. So I'm hoping we'll have time for a meditation session at the end. But this is the outline of how we're going to achieve this. First, we're going to spend some time defining integrative neurology and talking about the reasons why you might consider learning more about this. We're going to talk a little bit about what's happening at the AAN neurology level and also nationally. And then I'm actually going to pause there and take some questions and answers, because the first three parts are really a unified goal to explain what's going on with the integrative medicine, integrative neurology field at this time. And then depending on how much time we have, we'll move on to some really neat studies and some discussions on mind-body medicine. So before we begin, I'm going to begin with a brief video. I'm going to stop the share and share the video. I believe that's the right thing to do. So before we share, I'm going to be showing the video of a gentleman. This was years ago. I'm a general neurologist trained. I'm a longtime yoga and meditation practitioner myself. And we always experience, as practitioners, we know how our body changes. But the exciting innovations for us came in the early 2000s, 2010, when suddenly a whole lot of literature was coming out on how meditation affects the brain, how yoga and breathing practices. And suddenly we have fMRI, which can start to show changes. And that is what first got me lecturing on meditation and the brain. But for several years, I was just really talking about how it affects the brain and kind of generally. But that changed when I started to get interest from patients. Can you help me use meditation? And that's a quandary that you may experience. You may have some activities in your life that you know are really wonderful for the brain and the nervous system. But how do you start to talk about that with patients if we're not conventionally trained in it, if we don't have the randomized clinical trials to show that it helps? And this is what happened to me with one gentleman, and that's the video that I'm going to show. This is a man with Parkinson's who is a friend, a family friend, or a friend of a friend telling me, stress really affects me. Can you help me with meditation? Can you help me? Do you think that some meditation will help my Parkinson's? And I said, well, why don't we try it? And this is a video that we captured on this very first session when we met and started to work together. So you'll see him telling me that it's hard for him to move his two hands at the same time. Parkinson's disease is a condition where the dopamine cells are affected, and it really impacts motor coordination. Also, a lot of what we call non-motor symptoms, depression, anxiety are prevalent, constipation. But in this gentleman, he's telling me that his movements are impaired, and is it possible that meditation can help? Take a look at his hand motions in particular.
At the same time, I can't do it. It makes me tremor. Okay. I even try. But if I stop doing that, and that's all.
So now we've done some breathing exercises, and we have retrained the right hand to move mindfully. And Chuck is going to increase the speed just a little bit. Keep going. Very good. Good. Okay. So I hope you were able to catch at the end of the video that his fingers started to move a lot more fluidly. And for him, that was a really radical experience. By the way, this man's name is Chuck, and he has given permission kindly to share this video, because it helps explain a little bit of our story, of my story, and also a little bit of how one might consider integrative neurology. You have these possible modalities which may be helpful. What is the way that we can start to coordinate this to include some broader modalities into the general neurology sphere? And that's what we're talking about today. So we'll go to the PowerPoint and we'll start to review a little bit of that methodology. Okay. So before we begin, I do want you to challenge a little bit. Is there anything that you do for your own well-being, whether it's nutrition or sleep or getting a massage or relaxation, taking time for yourself? Do you ever recommend those therapies to patients? Is that even allowed in medicine? Is self-care a part of medicine? Just think for yourself, is there anything that you wish you could talk to patients about that you just don't know how? Okay, so we're going to move into defining what integrative neurology is and how that gives us an avenue to consider some of these additional modalities for neurology care. I will introduce to you here the Academic Consortium for Integrative Medicine and Health. I'm going to be talking about integrative neurology and integrative medicine a little bit almost interchangeably. Our subspecialty really is developing under the broader umbrella, the broader landscape of what we've seen with integrative medicine and health over the last couple of decades. The first National Center for Complementary Alternative Medicine was formed in 1998 or 1997, somewhere around there. So we are just about 25 years into this journey of a nation understanding that there is a role for integrative medicine. The Academic Consortium for Integrative Medicine and Health is a group of about 75 academic centers committed to the academic study and discussion on integrative medicine. And here is their definition of integrative medicine. It is understandably a little bit long, and we're going to actually go through it piece by piece as our overview of integrative medicine. So here we go, begin. Integrative medicine and health reaffirms the importance of the relationship between the practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals, and disciplines to achieve optimal health and healing. So if somebody reads this off to you and you're trying to listen to it without even seeing it, I imagine it might be a lot to handle. So we're going to break it apart and we're going to go through it. We're going to start first on what is whole person. So here on the screen is the VA model for whole person care. The VA has really embodied the fact that everything in a person's life contributes to their health, and they have created this model. So if you look at it, you have the individual in the center, me, mindful awareness, and surrounded is all the things that we can consider for health. Moving the body, our physical and environmental, emotional surroundings, work life, your personal development, our nutritional intake, our sleep and relaxation, our community, our connections, spirit and soul, and the power of mind to contribute to relaxation and healing as well. So this is what an individual is has going on every day. And everything from morning to night really has an opportunity to influence our health. You have this little circle or this sphere embedded in this larger circle that says on the right-hand side, conventional and complementary approaches, prevention and treatment, and then within that, you have the community. So this is an example of what we mean by whole person care. So in integrative medicine, we do like to get into details about a lot of things that are going on. What are your stressors? What is your family like? Are you moving enough? What is your diet like? So a lot of people, when you think of integrative medicine or integrative neurology, you may think about what that's like in terms of getting to know your patient. And that also bridges on this first definition, that it affirms the importance of the relationship between practitioner and patient. Because as an integrative physician, we can't really make headway until we understand all this about a person. And doing so, we form a relationship. It's not about treating the disease. It's about helping the individual navigate his or her own health journey. I want to showcase this diagram here, which I think is the best that I've seen in terms of explaining the landscape. So you have these intersecting circles, and in the center, you have an arrow that says integrative healthcare. And that's, again, this is in person-centered care. In the center, you have the individual, and this is everything that he's confronting. But the big circle on the top is conventional medicine, which is traditionally disease-based and a little bit focused on treating symptoms, often pharmacological. Most of the time it is pharmacological. But conventional medicine is starting to incorporate what we see on the left, non-pharmacological approaches, acupuncture, massage, certainly physical therapy is a non-pharmacological approach. So you have the overlap here of conventional and non-pharmacological or complementary therapies, and that's what we can call integrative medicine. The other green circle is self-care. Self-care really is a big part of health and healing. We see a patient for 15, 20 minutes, and we try to assess their situation, help them understand how we can help them move forward. But they're living their life on a day-to-day basis from morning to night. And self-care is how we can arrange our mindset to think about doing activities that help our flourishing, help our health and well-being. And for that reason, self-care is a huge part of integrative medicine. We want to give our patients the tools to learn how to care for themselves. And here you see an overlap, something called lifestyle medicine. So lifestyle medicine is a branch of medicine that focuses on the role of nutrition, exercise, sleep, stress management, and collecting all the data that we have for how our lifestyle influences health and disease. So we have an overlap between conventional medicine and self-care, that's lifestyle medicine. But when you're taking into account everything, conventional medicine, non-pharmacological approaches, helping a patient learn to devise their lifestyle to support health and healing, that's what this diagram talks about self-centered care, or the definition of integrative healthcare. This diagram comes from Dr. Wayne Jonas, who is a thought leader in integrative medicine. Dr. Jonas has been thinking about this for decades. He actually was the first executive director of the National Institute of Health, NCAM, back in the late 90s. He led the World Health Organization Traditional Medicine Initiative shortly after that, and he has focused his career on research, integrative medicine. For many years, he has 700 publications, and more recently, he's now helping professional medical societies incorporate integrative healthcare into routine care. I've had the privilege of working with Dr. Jonas as a mentor in a couple of projects, but that's separate from my assessment that I think this is an excellent way to understand the context of where we are in the larger landscape of thinking about health and healing, and how we can start to frame our mind of what is integrative neurology, what role do we play, what need do we fill. I'll get to it, but really it's as physicians, an integrative neurologist is somebody who is well adept and can talk about all these aspects and help guide a person to create his own health journey in a way that's meaningful for him. The last part of the circle is the cultural context of care. There's a lot of work, and we'll talk about it, but the recommendations we make must be aligned with an individual's view of worldview, of disease view, and of what's meaningful to him. So each of this, again, we get there by developing a relationship with our patients, but each of these is focused on guiding our patient on their health journey. Okay, so I'm putting this definition back up and focus, and I've outlined in yellow what we've already covered. We've outlined focuses on the whole person. We've talked about how you can make use of all appropriate therapeutic and lifestyle approaches, healthcare professionals and disciplines. And we can move on to the next part. I've actually already spoken about the importance of the relationship, and I've touched a little bit on health and healing. Just to recap, these are the organizations so far I've mentioned: the Academic Consortium for Integrative Medicine and Health, the VA, Wayne Jonas, the Healing Works Foundation. Okay, to round out the definition of integrative medicine, Dr. Jonas has written a book that I did want to recommend. He reviews a lot of studies, and he talks about what is healing. How is that different from medicine, from disease-focused care? With healing, when we engage in our relationship with a patient, we're trying to actually help them activate their own healing processes. And in his book, he demonstrates how 80% of healing occurs organically based on their day-to-day environment, mindset. And one of the metaphors that's very helpful to help understand integrative neurology and what we do, call it the gardener versus the mechanic metaphor. When we take your car to a mechanic, you try to find the one piece that's broken and fix it, and then help the car run smoothly again. In gardening, and it's what we're doing in integrative health and integrative medicine, we're trying to cultivate the whole being. So we're trying to provide as supportive an environment as possible to allow the body to naturally start its healing process. And in many conditions, that is possible. And this book, if you want to understand a little bit about this concept, it's a wonderful, thought-provoking book that very evidence-based, but he talks about some examples. First of all, the placebo response. How can we actually incorporate that positive encouragement into our interactions to help people believe that they can get better? It's very important for conditions like pain and migraine and headaches, functional disabilities, where the connections are still working. But what role can we as a doctor play in facilitating healing? There's some really exciting examples in here that I won't get into, but if anybody who's looking for a good read, this is something to consider. Okay, so we've now talked about most of the definition of integrative medicine and health. Integrative medicine and health reaffirms the importance of the relationship between practitioner and patients, focuses on the whole person, is informed by evidence, which we're going to talk about next, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals, and disciplines to achieve optimal health and healing. Okay, we're going to talk about evidence next, and how we use evidence to use additional modalities that we may want to integrate into our work. So evidence-based medicine has some very clear criteria that we should all be aware of in terms of what type of, when we make recommendations to patients, whether it's a medicine or not a medicine, everything there's research on all of this. And sometimes we're aware of it and sometimes we're not. In medical school, so we learn a lot about the landmark studies, but a lot of the times we don't. We get used to recommending even medicines, and we're not sure what are the major studies that have contributed to our recommendations. So I'm just reviewing here the criteria of evidence 1 to 4. So class 1 evidence are high quality evidence. They are based on systematic reviews and or meta-analysis that show high quality randomized controlled trials that show that an intervention is helpful. If the randomized trials are of small sample size or the quality is questionable, and there's criteria for what makes a high quality trial, bias, blinding, all sorts of areas which we should all be familiar with. But the level of evidence gets a little bit smaller. And as the evidence gets less quality, the number gets higher. So class 1 evidence is the best evidence. Class 2 is either non-randomized trials, cohort studies. Class 3 is descriptive research, observational trials. And number 4 would be expert opinions. So there are ways to make assessments without the randomized work, which is important sometimes when we don't have evidence for. But in general, we should be familiar with the evidence that we're aware of what we're recommending. The chart on the bottom, they both say similar things. So this is AAN recommendations, by the way. Once you have the class studies, you can then A, B, and C recommends how strongly we can make a recommendation. So if A requires 2 consistent class 1 studies or a systematic review that says this will most certainly help you, we can feel confident. We can say this is something that we recommend, and that's considered a level A recommendation. Level B is actually, this is defined a little bit here on the next slide. This is AAN approach, but AAN talks about A, this is established as effective. So yes, we recommend this for your particular condition. B, probably effective, maybe ineffective, we don't exactly know, possibly harmful. B is somewhere in the middle. C is possibly effective, ineffective, or harmful. We use the word probably or possibly based on how confident we are, right? So we can say it's either effective or ineffective and how strongly we can make that recommendation. So here I am, again, remember this is years back. I have someone with Parkinson's who's saying, can you help me use mindfulness for Parkinson's disease? So I'm going to use this as an example because it's so important for, I think, for all of us to know how to find the recommendation for it, but especially when we're talking about integrative neurology, and I'll talk about this why. If you're thinking about broadening your scope of toolkit, doing it based on evidence is my number 1 recommendation that I want all viewers to walk away with. So let's review the evidence. I'm going to show you quickly what that looks like. I'm going to just share my screen. Okay, we're going to go to this screen again, and I'm going to pull up mindfulness for Parkinson's. So I'm going to go to PubMed, and I'm going to say mindfulness for Parkinson's. What's been published before? I put this in to save time. So you hit enter, you hit search, hit enter, and you get your studies that come up, and you have to start being familiar with the literature. So there was a study in 2019 published in JAMA Neurology. This was mindfulness with yoga. There was a systematic review. So we're going to click on that and we're going to see what the systematic reviews says. And I can tell you that this systematic review in 2017 had only 3 papers and 2 trials that it included. The reason being that those were the only randomized trials that they used. But if you go back a couple years later, I'm continuing my search. Here I come up with another paper, and this is 2021. And this is it's a combination of a review paper. This is actually a review paper. It's not a systematic review, but it's a review paper with an opinion. And here's this beautiful chart talking about all the mindfulness trials that were given, including impact on motor symptoms, depression, anxiety, and the statistical and quality of life and the statistical changes from it. So here I am. Now I can go back to my patient and I can have an informed discussion with him. And I can say, well, there are some studies that do show there's possible benefit. And the way that I would handle this conversation, saying that we don't know for sure, but certainly there's little harm in trying it. I can provide you the resources to try this. It would require some time and effort on your part, but if this is something you're interested in, then I'm happy to show you the way. So my recommendations are, when we do have a conversation about additional modalities we're interested in, we have to be informed about the evidence, and it's our responsibility to disclose it to patients. And when you do disclose it to patients, then you actually having a lot of integrity as a physician. Even if you personally think it may help them, but the evidence is weak, we still can help them as long as they're informed about that process. Okay, I'm going to go back and I'm going to just finish up on this part. Okay, so going back to our thought questions, and I hope that after this discussion, you may have a better understanding of how you may approach when this comes up in your own practice about something that you're not quite sure about, but you think it may help. And I hope now you may have the tools to answer that by looking it up on PubMed and getting the answer yourself. And secondly, a little bit of confidence that that maybe you can recommend these therapies you wouldn't have thought before. I will say that in PubMed, there's now so much literature on integrative neurology modalities, from acupuncture, massage, yoga, supplements, almost anything you can think of that patients ask you about, you should be able to go online and find some studies on. And then it's your job as a physician to interpret the quality of that evidence. Okay. So I'm biased. I think integrative neurology has a lot to offer patients. You can guide them on this health journey in a way that's a little bit more thorough than just giving a medicine. So where are we now in terms of the landscape? Challenges is that the research is still difficult. The trials are hard to execute because of the criteria for class 1 studies. So they have to be blinded, they have to be very controlled. And when we're offering an intervention or an integrative healthcare journey, oftentimes it's personalized. It's taking into account the whole person. So we may not want the same exact regimen for every individual. We may not want the same exact diet or yoga protocol or relaxation strategy. But to get class 1 evidence for disease outcomes, that's what we have to do. Funding is also challenging to do, but the research is getting there. Partly because of patient interest, we do have more money coming in. So hopefully the research trials will become more robust and more plentiful as we're carrying on with this integrative neurology journey. Secondly, what is the infrastructure to support patients in this whole person care? Do we just give them a diet plan and say, okay, see you in 3 months? From my perspective, if I'm giving some relaxation strategies, this is a skill they need to learn. What is the infrastructure to support patients in this journey? And I can talk a little bit about that, but this is just a challenge in general. And how do you get reimbursed? As I mentioned, it takes a lot of time per patient. So the reimbursement for a standard neurology appointment would turn out to be difficult to fill a full integrative neurology clinic with if you're going just through reimbursement. For this reason, actually, many integrative physicians choose to go for cash payments for integrative counseling. And this creates a problem because then it's an issue of access, that not everybody can afford it. I'm just being honest about the challenges and logistics of it, because you may see a lot of integrative medicine clinics that you'll see are cash-based. One last issue that we see with integrative neurology, coming back to this sphere on the right. It is a lot of different modalities. Once you're talking about including all modalities, we have an open playing field. I am somebody that's interested in yoga and meditation. My colleague is interested in nutrition. Another colleague is interested in exercise and giving recommendations for specific kinds of exercise to include. There's a lot, it's difficult to find consensus even among us integrative neurologists. We all have many different interests. So what we're finding, and I'll talk a little bit about our group at AAN, the section on neurohealth and integrative neurology, is we have a lot of diverse conversations. We're learning from one another, but it's not so easy to come up with a guideline to say that this is what an integrative neurology does, because you do have the freedom to cultivate your practice in a way that's unique to you. That being said, the fact that we have so many, our group now has 450 members at the AAN, and I'll talk about this in a little bit. And there's clearly interest in it, and there's a need for it. And this is now the why of integrative medicine. So why actually, other than wanting to expand the neurology toolkit, why do we want to offer integrative medicine? And the reason is because our patients are using it at a very high rate. So the last study was 2012, the NHANES survey. They had 33% of adults, 11% of children are using some sort of complementary medicine, a huge market, a huge percentage of healthcare costs, and most don't disclose to their physician that they're using this. So really, the reason is because our patients are using it, and we can help them on their journey towards health and healing if we're more informed about what they're doing. And in order to have that conversation, you have to be informed about integrative therapies and the evidence behind it. Once you learn the evidence, the conversation becomes quick. You ask them what they're doing, and then you can give your feedback. Do you agree? Do you don't agree? There's a nice study published a number of years back, showed that even compared to that survey that showed that about 33% of adults were using complementary therapies, among patients with neurological disorders, that number is at least 10% higher. So our patients are using it even more than the traditional patients. So here is how I define integrative neurology. It's the coordinated delivery of conventional neurology combined with lifestyle modification, evidence-based complementary therapies designed to enhance health and well-being and treatment of neurologic disease. So we use these recommendations to help them enhance their own well-being, their own healing, also for the neurologic conditions, such as their movements in Parkinson's, but it's coordinated. It's all under one roof. They can come to one physician whose recommendations they trust, and they can get answers about how they can structure their lifestyle and their outside activities to facilitate their healing. So we've already covered these two, high patient interest, and it's rewarding for us to expand neurology toolkit. This is a picture back from 2018. We had a section formed in 2016. That's when we were recognized. It's one of the sections within the AAN. AAN has multiple sections, and I'm going to skip this for 1 second. So there's a resource in AAN called synapse.AAN, which is communities with different subsections. So you can join a conversation and be included on email chats of members of behavioral neurology or epilepsy, headache. There's probably close to 40. I think there's between 35 and 40 different sections, and we are one of these sections. So we were formed back in 2016 with 20 members, and now we have greater than 450 members that are joining our conversation. I'll spend some time talking about what else is happening in AAN. So at the upcoming annual meeting, we have, there's a couple areas if you're interested in attending the meeting. There's 2 educational courses. That's the middle bullet there. There's case studies in integrative neurology. There's another course on nutrition and neurological disease. The top bullet there is the experiential learning area, the wellness hub, where you have yoga, meditation, and I think massage. I actually used to be very involved. I used to chair that committee, but I'm not this year. So in the past, we used to have massage, but this year they definitely are having meditation. At the least I will be teaching meditation there. And traditionally we have yoga, meditation, massage. So some opportunity to explore these therapies yourself. It's a great way to start to learn about integrative neurology therapies, to do it yourself. Go for an acupuncture session, get a massage, get a Reiki treatment, do a craniosacral session. And then you can start to understand a little bit about what your patients may be experiencing. There's also the last bullet there, section spotlight on brain health. I just want to talk about one other initiative within the AAN. So our section is called Neurohealth and Integrative Neurology. We talked a lot about integrative neurology, but where did neurohealth come from? So neurohealth comes from the fact that we're supporting patients in their health journey. This is the World Health definition, the World Health Organization definition of health, that health is the state of physical, functional, and social well-being, and not merely the absence of disease. So we define neurohealth back when we formed our section in 2016 as a state of physical, functional, and social well-being of the nervous system, and not merely the absence of disease or infirmity. And these are all just a snapshot of the contributors to neurohealth. Back in 2018 was the beginning where the AAN started to talk about brain health and their initiative. This has a lot of poignancy because this is a statement by Ralph Sacco that came out in March 2018. Some of you may know that Dr. Sacco passed recently, unfortunately. I'm putting this in here. He really was a visionary. Dr. Avitzer is now promoting this vision, but this is what he wrote back in 2018. How can the Academy expand the scope of neurologic practice to include a greater emphasis on preventive, interventional, and regenerative care? And this is his quote, "To the public, our message will be that the neurologist is the key physician to optimize brain health, and we will affirm to payers and policymakers that neurologists are quality and value-driven and leaders of the neurology interdisciplinary patient care team." We can be the leaders. We have to be the one that use all ancillary staff, and that includes acupuncturists, physical therapists, complementary therapists, to help our patients achieve their goal of healing. And this year, or just a couple months ago, there was the inaugural Brain Health Summit. And this is, the AAN has now announced an official initiative on brain health. And this was released in an editorial on September 15th. How healthy is your brain? Improving the nation's brain health is the focus of a new AAN plan. You only get one brain. How to keep it healthy over a lifetime is at the core of the newly evolving field of preventive neurology. So we're pretty sure that all the work that we've been doing as integrative neurologists is going to contribute to this initiative, not only from the knowledge that we've gained working with patients, but also from the logistical challenges. What is the support system that we're going to use to help our patients achieve brain health? Why integrative neurology? Not only patient interest and the opportunity to expand neurology, but because it's the future of neurology. Okay, so I'm going to stop here, and I'm going to actually go for some questions.
So Steve Plantko has a question very similar to what I was thinking. First, he thanks you on your insight for the topic, but the biggest challenge that he foresees, and myself, I would echo this, is access equity issues. The patient population I see is about 40% Medicaid. How have you seen in the section that you work with, how have you seen people try to overcome these obstacles of access, being able to get these resources to patients who may be underinsured or uninsured and don't have the means to pay for them in cash?
So we don't have an answer to it, but in my work, I have collaborated with people that have followed the same mission that I have, is that we need to make these available. So I have worked with acupuncturists and complementary therapists, and we're actually not worried about money right now, for better or for worse, but we do make arrangements with the patients to offer these therapies. I worked at a wonderful clinic in New York City. It closed during COVID, but it was an interdisciplinary care team. And we would just come together. We would offer different therapies to it. And we would take nominal fee for it, but the benefit of it is that we're actually collecting data to contribute to studies in the future. So what happens? So it has to be a stepping stool that we eventually need to get reimbursed from it. And the avenue that we see for it is that we need to start collecting data. So we would have people fill out questionnaires. We would put that effort in to collect data, which then could lead to either grants or to philanthropic contributions, which is so far what has happened to us. So I will say that that's how I started with the meditation for Parkinson's disease. It was quite successful, but I was offering for some cash payments, but we've since transitioned. I got a grant to offer a meditation program through Cornell, through their Parkinson's community grant. We're now transitioning to an online platform, and we did get a private donation to fund future programs and also to cover research. Now we're going into official research. So that's sort of the stepping stool, but it does require, it is limited now. I will say that insurance can cover, for acupuncture, some insurances will cover acupuncture. So we're starting to see increased coverage, but it is a lot of advocacy on your end and collaborating with finding like-minded individuals in your community who may be willing to help you get these services. And the most important thing I would say is try to collect some sort of data, which then can yield some types of reimbursement in the future.
Thanks for that. And another question or comment really pop up by Dr. Guduru from Lexington, Kentucky, said he seems to have some similar programs to what you're talking about offered by the local Parkinson's disease support group. So it seems like looking out to patient support groups and things like that nature may be a good starting point for people interested in trying to get access to these treatments for their patients.
That is a great point. Yes, thank you. There is actually national resources, and many of them, patient advocacy societies, support groups will start to be offering them. Mm-hmm.
If you are not personally trained in meditation or yoga, is there a resource, would you say the AAN would be a good resource to find people in your area who might be able to offer these services to your patients? Yeah,
we actually had talked about that also, starting a hub or a network map. I think the AAN, our section, is a good resource to talk about how to collaborate with individuals, but really the best is to reach out and start exploring, find a yoga studio and take one of their local classes or meditation sessions and let them know that you're a physician looking for some place to refer patients. It does take a little bit of trial and error to get to become familiar with the modality so that you can assess the quality of what we're trying to offer. But you have to start somewhere, and you'll become so much more informed, and it won't take that long. You can trust your own instinct that if you liked it and it's good, that it's a quality service. It's quite important to make sure that any physical therapies are appropriate for patients with disability. So, a yoga class really has to be quite gentle for someone with Parkinson's disease, for example.
Where's the line, if there is a hard line, between sort of traditional non-pharmacologic medicine and what you would consider complementary therapy? Like, is all non-pharmacological treatment complementary in some way, like psychotherapy, for example?
Yeah, it's not a hard line. Yeah, it's very blurred. I think, and it's changing all the time, what's considered acceptable. I think acupuncture has become a lot more acceptable. It's covered by insurance now, and the research base is pretty big. But I think still, if there's a neurologist that's trained in acupuncturist, for example, you still might. That's not exactly the norm yet. Yeah, I think I don't think there is a line. I think that in integrative field, everything can be considered part of neurology care as long as we have the evidence to work with it and see that there's some sort of evidence for it. I'm thinking about the question for reimbursement. I feel like there's probably some other answers also for how we do it, but that's not coming to me because it requires a little bit about being creative.
Yeah, I think in a practical sense,
Yeah.
In academia, outside of academia, I feel everyone's feeling more and more pressure to make the bottom line work out. And I know a lot of my friends in private practice, they have 20 minutes with a fellow patient, no more, or they'll start getting someone who's going to start getting upset with them from high above. And like you said, doing this well, you can't do it in 20 minutes. You can't do it in 10-minute follow-up.
No. No, it's really hard and it's stressful. Yeah, I've been there and yeah, trying to. I did remember what I wanted to say that. So Wayne Jonas, who I mentioned a couple of times, he's now dedicating his work to helping societies integrate, making integrative care part of routine care. So his methodology is working on the reimbursement code. So you can use group visits, shared medical appointments, which is a great way because you can bill 99213 for 10, 15, 20 people in a 2-hour block. And then you can give wellness education in that time. And also about creating resources. So if you have a resource sheet handy that you can just hand to patients, then it doesn't take time. You can say, oh, you're interested in updating your diet? Take a look at this. And that will then guide them on their journey. So it comes from us, it's credible, it's respected, but they'll do the work on their own. So that's really the methodology, finding the reimbursement codes and being prepared with resources and getting to know your community, what's in your community that you can refer patients to.
Great. I think that wraps up our current questions. If there was a little extra, you said you had some other topics you wanted to entertain.
Yeah, I do. We can talk a little bit. Let me just see if, we've got 13 minutes left. So give me just 1 second to take a look and see what makes sense. I think I'm just gonna highlight a little bit about some of the evidence base that I work with. So I'm gonna share just a couple of my top studies for mind-body medicine, how the impact of our mind, our emotional state on our brains. And then I'll do a little bit of a breathing exercise as we end up today. So let me go ahead and share some of my favorite studies. So let's see. Okay, I have to scroll through, excuse me for a second. I get to where I need to be. So my approach to teaching meditation is a neuroanatomical based approach that when we have thoughts in our head, they are activation of our brain centers, of our brain network. And we have fMRI studies that show that generally mind wandering, when you're sitting and daydreaming, it involves what we call the default mode network and the executive network. So executive network is your future planning. And the default mode network is essentially networks that connect the limbic system, the hippocampus, and the frontal lobe. So it's basically your self-referential story. So if you generally are told to lie in the scanner and do nothing, which is how they figured this out, the brain network becomes active, and it's what they call the default mode network. And it turned out that that's mind wandering. And it's usually either people thinking about their past, like a conversation they had, or a particular experience, maybe an emotionally poignant experience, keeps coming back in your mind, ruminating. That's your default mode network that keeps acting up. And very often people are planning their to-do list, their grocery list, what they have to do as soon as they get out of the scanner. So that's the executive network. So mind wandering is your default mode network and executive systems running rampant. That's what we teach you to control in meditation. And when you actually become aware of your thoughts, that you are mind wandering, this slide here shows that as soon as you become aware of it, that's what meta-awareness is, this thinking network calms down. And there's actually many neurologic benefits to learning to calm down your mind wandering network. The top slide is your default mode networks that mind wandering that are running rampant without you really being aware of it. With meditation, you learn that you can have a whole conversation in your head before you are aware that you're having a conversation and you're not focusing on the breath, which is what we're going to do. So chronic stress, a lot of our ruminative thoughts are stressful to us. And if you're thinking stressful thoughts, your body is going to be in a stress state and you're going to be releasing stress hormones. Stress is not good for the neurons. What you have on the left is a control neuron, and this is on the right this is an animal study. So this would be a class 4 or lower, I think class 5 study. This is not for humans, but you see that their neurons, their dendrites literally shrunk when they're in a state of chronic stress. And we do know that chronic stress leads to cerebral atrophy, hippocampal atrophy in humans. This is a cool study in 2012, a class 1 study on people with multiple sclerosis, that when they underwent stress management counseling over a 6-month period, they had fewer lesions showing up on their MRI of the brain. And then as soon as that counseling session ended, the number of lesions normalized. So this does show that over the 6 months that they were specifically giving tools to keep their stress under control, that they were having decreased plaque formation. This is a study that shows the impact of an 8-week course of meditation in people with mild cognitive impairment on the left and Parkinson's. So this is a really neat study on the left. MBSR is a standard 8-week meditation course. But people with MCI who underwent 8 weeks of mindfulness training, they had some increased activation and connectivity between the frontal cortex and their left hippocampus. But on the bottom, we see that their cerebral atrophy stabilized. Hippocampal volume. Over an 8-week period, the control group, which is on the right, they still had continued decreased in volume. So you see this general line show that the overall volume of their hippocampus continued to decrease over 8 weeks. But with meditation, it stabilized. That's the group on the left, that their hippocampal volume stabilized and in some areas even increased a bit. We do know that meditation, it increases connectivity of the hippocampus to both of them. And that's what we see in the right graph also, that this is a group of Parkinson's patients who underwent a mindfulness intervention, and their right and left hippocampus also had increased volume after this 8-week period. And I think that's it for the study. So I'm going to just end this. Unless there's any pressing questions, I'm going to go ahead and lead us in some little breathing exercise and a little experience in meditation. So I invite everybody to get settled in your seat. Find yourself bringing your attention to your chair that you're in. Uncross your legs so that both feet are on the floor. And bring your attention to how your hips are supported in your chair. And feel how you don't have to put any stress or effort or activation into your hips or your legs. The chair is supporting you. And feel your feet resting on the ground. And feel how you can try to relax your legs and how the ground is supporting your feet. We'll start with a quick body scan. We'll do a few minutes of breathing exercises. And then I'll lead you on a guided meditation that I hope will end. It might end just 1 or 2 minutes after the hour. It's 12:54 right now, or in East Coast time, it's 12:54. So if anybody has to go, please watch the time. Okay. So go ahead and bring your attention to your feet resting. Oh, I invite you to close your eyes if you are interested. And go inward to the sensations of your body. Bring your attention to your feet resting on the floor. And see if you can feel any sensations in your feet right now. Do you feel any tingling, any heat, any warmth? Bring your attention to your thighs on the chair. Feel the contact between your thighs and your hips and the chair beneath you or whatever it is you're sitting on. Bring attention to your hands. I recommend placing your hands in your lap if that's comfortable, otherwise on the chair, and just invite them to relax and feel the contact of the arms to whatever surface they're on. Any heat between your hands and your thighs if your hands are on your thighs. Bring attention to your head, balance on top of your neck. This is a good time to try and straighten your posture. See if you can sit upright and see if you can feel your spine holding your head and your neck up. Feel your head balance on top of your spine. And on the exhale, invite the shoulders to relax, the muscles to relax. Feel your tree, if you can feel your head centered on top of your spine effortlessly. And then bring attention to your chest and your torso. And first take note of the rhythm of your breath, the inhale and the exhale. No need to do anything, just bring attention. How is your breathing right now? And if you need to readjust to be in a comfortable position, go ahead and do it. Just do it mindfully and then bring your attention back to currently the inhale and the exhale as it is. Very quickly, we'll complete our body scan. Bring attention to your belly. Any sensations there, any discomfort? Is it relaxed? Any pain? Just notice. Mindfulness is the ability to notice in the present moment. What we're doing is we're bringing our awareness to what's happening right now. We're using our sensory cortex, our sensory capacity to just feel. We're trying not to judge or interject with any dialogue. Just feel with this internal awareness. Your belly, maybe your heart. Can you feel your heart beating? Just bring your awareness to your torso. And now back to your breath. Okay, notice the inhale and the exhale. And try and stay focused now on the entire cycle of the breath. From the inhale to how it slows down and transitions into the exhale. The in, transition, and out. The in and out. In and out. Try and do this in a relaxed manner. Make sure that your belly, your torso is relaxed so you can let the body breathe as it normally does and just observe. And if you can send the message of relaxation, your body also follows. Just by observing your breath should send a signal that it's okay to relax. Okay, I'm going to do a little bit of pranayama, intentional breath control. I'm going to encourage you now to try something called box breathing. So follow my rhythm if you feel comfortable. I want you to inhale for 1, 2, 3, 4. Hold the breath. Pause for 2, 3, 4. Exhale, 2, 3, 4. Now pause your breath. Hold 2, 3, 4. So in between the inhale and exhale, you're kind of stopping your breath and just holding for 4 counts. We're going to try it again. Inhale, 2, 3, 4. Pause. 2, 3, 4. Exhale. 2, 3, 4. Pause. 2, 3, 4. Inhale. 2, 3, 4. Pause. 2, 3, 4. It's just about top of the hour for anybody who has to run. I'm just going to conclude this in another minute or two. Exhale, 2, 3, 4. Pause, 2, 3, 4. Inhale, 2, 3, 4, and release. Release the breath control. And just sit comfortably for a few minutes. I'm going to leave you in some silence. It's not ending yet. I will end properly. But in these periods of silence, I want you to see if you can catch your mind wandering. So go ahead and bring your attention to your breath. Feel the inhale and the exhale, either in your torso or in your nose. Feel the breath coming in, nose or mouth. Just pay attention to it for just a few minutes. Stay focused on the breath, the inhale and the exhale. Inhale, exhale, and transition between the two. And try to concentrate for just a minute or two and see if you can catch your thoughts popping up. Go ahead, stay focused. Inhale, exhale. Stay focused on your breath. You're just feeling the sensations of your breath. If you notice your mind wandering, go back to your breath. Concentrate. This is your practicing your skill of attention and concentration. Stay with it for one more minute, and then we'll wrap up. It's soothing. Convince your mind this is a pleasant thing to do. Your mind wants to jump around. Focus on the breath. Okay, and we'll wrap up. I invite you to go ahead and release your concentration. Go ahead and go back to your normal breathing and gently open your eyes and come back to the room around you. And take a minute to note if you feel any more relaxed or calm than maybe you were a few minutes ago. Okay. So that's all from me. If there's any other questions, you can email me. I'm at info@mindfulneuro.com. That's my I'm going to type it into the chat. And otherwise, hope to see you at AAN. I lead a meditation session, and I'll be at the section meeting for neurohealth and integrative neurology. Okay.
Thank you, Dr. Molokotla. That was wonderful. a nice break in my workday. Thank you so much for everyone else also joining us today at the AAN Virtual Resident Education Lecture Series and Meditation Session. This is recorded and will be posted on YouTube. Again, Dr. Molokotla, thank you so much. Dr. Weber, of course, thank you as always.